Bismillah. In this video lecture, we are going to talk about ketamine, which is a dissociative anesthesia. The first thing is ketamine is a dissociative anesthesia. That means it disrupts the thalamocortical system, and through that, it causes change in the awareness. Uh, at some places, it is said that the mode of action of ketamine is unknown, but in other areas, it is also referred to as an NMDA receptor antagonist, which causes a cataleptic state of central nervous system where the patient neither sleeps nor responds to the stimuli. So you can perform the surgery using ketamine. Um, with ketamine, the eyes of the animal will remain open during the surgery, and because of that continuous opening, the eyes will become dry. And to prevent that dryness, because if they will remain dry for like 1 hour time period of a surgery, or sometimes if the surgery is more prolonged, like 2 hour surgery, so there is a risk of developing ulcers because of the dryness of the eye. So you have to administer the tear drops, which is a commercial preparation that are administered into the eyes, or normal saline if you don't have any such preparation available to moisten the eyes. So you can use normal saline. Ketamine also causes muscle rigidity and tremors. So it is contraindicated in the orthopedic surgeries, or orthopedic surgery, because in orthopedic surgery we need muscle relaxation, because we have to reach the bone by separating the muscles. So we need muscle relaxation. Uh, or if you are using ketamine in the orthopedic surgery, then use in combination. You will use it with any other anesthetic drug that will give a good relaxation, muscle relaxation to the animal. It is also not used for like taking X-ray radiographs, because even in radiography we need animal muscles to be relaxed. So these are its contraindications regarding its property of muscle rigidity. Next, ketamine has good superficial analgesia, but it will provide poor visual analgesia. So it is always used with other agents like alpha-2 agonist, opioids, benzodiazepines to provide a complete analgesia. There is a popular combination that is called as MLK. MLK basically means morphine, lidocaine, and ketamine. Through this combination, you can have a good analgesia, and you can perform the whole surgery. Ketamine also acts as an anticonvulsant or has neuroprotective property. Next thing is ketamine crosses the placenta and it will enter the fetal circulation. So, if you are using the ketamine in the C-section surgery, that means the ketamine will cross the placenta, enter fetal circulation, and it will cause neurologic reflexes in the C-section born puppies. There is another use of ketamine and tilitamine in snakes, that they are used to anesthetize the snakes for non-painful procedures like skin biopsies. But if you have to perform a thorough surgery of some visual organ in the snake, you will never use ketamine, because ketamine only provides good superficial analgesia. Then for snakes, you have to go for some inhalant type of anesthesia. That is a separate topic to study regarding the anesthesia of the exotics. So next thing is regard ketamine effects on the central nervous system. It will increase the cerebral blood flow, which will increase the intracranial pressure. That is a very, very, very important thing to remember. Ketamine increases the intracranial pressure, which means two things. Number one, here you can see, because it increases intracranial pressure, so it will be contraindicated in the patients with the head injuries. So remember always remember that if you have a patient with head injury, never use ketamine. And the other thing is, if you have injected ketamine and you see that intracranial pressure is increasing and it is causing some issues in the animal and you want to reverse it, so you can control this condition by using benzodiazepines or barbiturates like thiopental. Because when we will study benzodiazepines or barbiturates, we will see that they have the property of decreasing the intracranial pressure. So that is a good thing. Then ketamine also increases the sympathetic tone. That means it increases the intraocular pressure, the pressure in the eye, and cardiac output. As it increases the cardiac output, so it is also contraindicated in cats with hypertrophic cardiomyopathy. What is hypertrophic cardiomyopathy? Those who are studying for like board exams of BCSE and every, they will for sure study in their medicine that cardiac cardiomyopathy, hypertrophic cardiomyopathy, HCM, is a very common condition in the cats. And if the cat is having that condition, you will never use ketamine in that cat. Also, we avoid ketamine in glaucoma, because in glaucoma intraocular pressure increases. So already, if the intraocular pressure of the eyes increase and you are using ketamine, it will further increase the pressure and it will cause pain and all those like more dangers will happen to the eye. Next, about induction and recovery of the ketamine, you should remember the ketamine has violent induction as well as recovery. Because while recovery, animal will be having abnormal behavior that will be leading to emergence delirium during recovery, ataxia, touch sensitive, and increased motor activity. Like you will see the animal will be having vocalizations, painful recovery. He will be touch sensitive. So the recovery of ketamine is not smooth, as well as induction of even ketamine is even not smooth. And that is why we always use ketamine some other anesthetic agent. We always use ketamine in some balance anesthesia. So the shortfalls of ketamine, like this violent recovery, muscle rigidity, these things are basically like balanced by use of some other anesthetic agent, like we have mentioned here, alpha 2 agonist, opioids, benzodiazepines. Like we balance the ketamine, otherwise never use ketamine alone, because you will be having violent recoveries. Next, the effect of ketamine on the respiratory system, that is important. Ketamine causes apnea in a way that there will be prolonged inspiration with very short expiration. Bronchial smooth muscles will be relaxed, and there will be bronchodilation. That means decreased airway resistance. So it is a good choice for patients with asthma and COPD. It is chronic obstructive pulmonary disorder. So if your animals are having these issues, you can use ketamine, like without having any risk. Rather, it is a favorable choice for such patients. Then pharyngeal and laryngeal reflexes will remain intact with ketamine, but ketamine increases the salivation in the GIT system and respiratory tract secretions, and because of that, there will be a risk of aspirational pneumonia. That animal will have like although that saliva and mucus in his trachea, and aspiration pneumonia will happen. So in order to avoid that condition, you can use either endotracheal tube or use atropine as pre-anesthetic, that will decrease the salivary secretions or respiratory tract secretions and risk of pneumonia. So that was all about ketamine you should know as far as board exams are concerned, and this is only clinical aspects or properties of the ketamine. That was all. Thank you so much.